Hi, I'm Dr. Kush Gupta, and I want to thank you for joining me on another episode of Medicine Mentors, where we interview masters in medicine, leading physicians at the top universities across the US to learn from their experiences and derive key insights, traits, and best practices that can guide medical students and residents. Today, we have a very special guest, Dr. Edward L. Barnes. He's Assistant Professor of Medicine in the Division of Gastroenterology and Hepatology at the University of North Carolina at Chapel Hill. He has an illustrious career in medicine and research. Having published more than 60 research papers, he has been the recipient of the 2017 Pilot and Feasibility Award. Without further ado, let's hear directly from him. Thank you, Dr. Barnes, for giving us an opportunity to learn more about your life story and experiences.
Thanks so much. I appreciate the opportunity to speak with you today.
So could you tell our listeners about your journey so far? If you could take us through your childhood until now and share with us the major events or experiences that shaped you the way you are today.
I'll try to be brief because I've had a lot of influential people that have sort of shaped me along the way. But I grew up in South Carolina. I think probably the reason, I don't know, a lot of people say that they knew they wanted to be a doctor from the time that they were, 4 years old or something like that. I wasn't like that. But I had a really influential person, one of our close family friends that was a family medicine doctor in a rural town in Virginia. I was actually born in Virginia before we moved to South Carolina. And he really shaped me to see what medicine could do for people and how you could develop relationships in medicine. And although my career is very different from being a rural family medicine provider, he was really the inspiration for me to go to medical school. But when I got into medical school, one of the key things that I really got into when I was in medical school was the idea of getting into academic medicine. I really liked the idea of internal medicine. And so when I was a fourth year medical student, I actually came to the University of North Carolina and did a GI consult rotation. And I would say that was potentially the most fundamental experience of my career thus far, because I had the opportunity to work with some great mentors who are still my colleagues here at UNC today. And I got interested in inflammatory bowel disease. I got interested in GI. And so when I came here for residency, I started working with them from day one. And I can still remember being on rounds as a medical student and certainly getting involved in research and getting involved and just understanding better about GI, working with those mentors from that first experience. But I think that the reason I say that was a really influential decision for me is because I latched on to something that really motivated me and something that really excited me. And for every day that I was sort of involved within IBD and really involved within GI, I wanted to learn more. And I was always never sort of satisfied. I always had more questions. And my mentors really inspired me to want to learn more and to want to figure out new things. And so because of that, I went into GI fellowship and I decided to pursue a research career, and I decided to come back and do another fellowship in IBD and then ultimately to join faculty here at UNC. And so I think that some of us get lucky in that we just are in the right place at the right time. And for me, it may have been coming and doing that away rotation and being on GI consults for that month that I spent here at UNC. And I'm happy to sort of expand on any of that. But I think that that's one of the things I think is critical in anybody's career is that it might just be happenstance that you get placed with the right person that inspires you. And for me, it was a certain set of mentors that are now my colleagues here at UNC.
So during your journey, you mentioned you had a lot of influential people throughout your life. What role did they play in your personal and professional growth, apart from showing you a path into academics?
Well, I think one of the key things is, as anybody that's in training or anybody that's trying to figure out what their career is going to look like, you have to decide what is the best career fit for you. And it's going to be very individual. That's what I think is probably the most exciting thing about medicine is no day is going to be the same. But you have to find the little area of medicine that maybe fits you the best. And that's where this idea of career fit comes into play. And I think to answer your question directly, my mentors were among the most influential people about helping me and pushing me to find what was going to be the area that I felt the most comfortable in. I mentioned that the very reason that I went into medicine was because I saw the interaction between my family friend that was a family medicine doctor and the way that he interacted with patients. So I've always been very interested in patient care. But when I got into residency and certainly when I got into GI fellowship, I realized that I actually got really challenged by clinical research. And so I wanted to learn more about not only just how clinical research is done, but advanced techniques in clinical research. And my mentors were the ones that really pushed me to go forward and to get an advanced degree, to get a master's of public health, and then to really think about how could I move my research career forward in terms of grant funding, applying for funding, these kind of things. But very early on, another person might say, I like doing a research project. I understand that this is important as far as moving our field forward, but this is not for me. I don't like getting grants rejected. I don't like writing grants at all. I just like being in clinic. I just like being in the hospital. I just like taking care of patients. And this is what drives me to want to get out of bed and be a doctor and be a physician and take care of and kind of move our field forward.
So can you share some of the challenges you faced on this journey and how you overcame them?
I think one of the biggest challenges that we're all going to face within medicine, and particularly within academic medicine, is the idea that time is not infinite, right? And so finding a really nice balance of time is very difficult as a medical student. It's very difficult as a resident. And unfortunately, or as a fellow, whatever your training level may be, it doesn't necessarily get any easier once you graduate from training and you get into practice as an attending. I think that finding a good time management strategy becomes critically important because we like to think that we are devoted to our careers, but we also are devoted to other things in our lives. It's kind of a cliche answer, but time management is not a cliche. Time management becomes critical because the other thing that we're going to deal with all of the time is rejection. Anybody that gets into medical school knows how stressful it is to get into medical school. Anybody that gets into a residency knows how difficult it is to get into a residency or a fellowship or to get their first job out of fellowship. And the way to maximize each of those opportunities is to realize that rejection is part of the game. And you just have to pick yourself up and move forward. And the way that you do that is really bucketing your time and realize, how am I going to do this to do all the things I need to get done in a day to make myself the most successful.
So how did you manage to manage this bucket of multiple boxes, if I would say, of your personal life, of your hobbies, of your work? How did you manage it?
I would say that there's times that I probably manage it better than others. You might have to give up some of these other things at one point at a time. For instance, that you're a clinical researcher, that you have a big grant that's due. You should hopefully have a really good support structure around you in terms of your family or your friends or whoever that support structure is, to say that this is a really hard time for me for the next couple of weeks. And I may not be around as much, I may make it home for dinner, but maybe after everybody else goes to bed, I may have a few other things that I have to do at night that I typically don't do. Or maybe I'm getting up in the morning to do some things that I typically don't do before I go to work, or whatever that may be. That bucket gets shifted around.
So anticipating that and realizing that that's not the end of the day, and it's just about prioritizing things at different points of time and still trying to balance all the things that we have in the bucket. That is the key.
I think so, because I think that one of the things that you really ultimately want to avoid is this idea of burnout, right? And if you get into this hole where you're just focused on one thing, this is probably what leads to burnout. And I mentioned very early on career fit. And I think that if you don't have this idea of career fit, if you're not in a job where you wake up every morning and you're excited to go to work and you're excited to do the things that you're supposed to do, that your boss is expecting you to do, or your division chief or whoever is directly above you is expecting you to do, then you're probably at risk of becoming burnout even very early in your career, not late in your career, but right out of fellowship or even during fellowship. Because if you don't have that balance and you don't like what you're doing, that's just a recipe for a disaster, in my opinion. I think that if you do have balance and you do like what you're doing and you've really been introspective about what it is that makes you tick, what it is that makes you excited about your career, I think you're going to be set up much more for success.
So have you always been successful, or was there a moment of decision in your life which was a turning point for you?
I'm always striving for success. I'm motivated by the people around me, and there's people that I want to be like every single day. And so I still have things that I'm trying to do. So I'd say I'm very low on where I want to go. But yeah, there were definitely times where I have struggled even to get to very early in my career where I am now. I think making a decision about what kind of career I want was a very difficult decision for me, and one where I still try to wear a lot of different hats.
You mentioned you served as the chief resident in internal medicine at the University of North Carolina, and now you are the associate program director for fellowship in gastroenterology and hepatology. So, as a young leader in medicine, what are some of the most common challenges that you have identified in medical education, be it at the medical school level or the residency level or even at the fellowship level?
So I think that trying to develop a curriculum and trying to develop a learning style, particularly among residents and fellows, that is efficient, that is practical, but that is also extremely useful for residents and fellows is among our biggest challenges, because residents and fellows are among the most busy people in the hospital. Medical students are as well. If you have, particularly in COVID-19, when we're having to do a lot of things virtually, where we have these virtual meetings and we're meeting for an hour, where people might be getting paged, or they might be getting pulled away from their computers, or they might be answering calls. I'm not sure that that is as effective as it probably could be, trying to find the right time to do that. For instance, residency program, I think that's a real challenge, and trying to efficiently teach people in multiple different ways becomes a really thing to think through as a program.
So, what are your views on how these issues can be dealt with better?
Yeah, I think that one of the really critical things that we try to do as a program is really be sort of fellowship, that we need to totally redefine that. And it needs to be that we need more hands-on learning, or we need a totally different learning style for that, because what we've been doing hasn't been working. And so that's when we go back to the fellows and talk about why are we struggling in this area and how can we do better. And I think that's the sort of thing we really want to think through as a program. And the methods of education can be very different once you get outside the scheme of medicine. And I think that was a really revolutionary experience for me, just to think about how I am as an educator. And I can't say that I've brought everything that I learned in that year to rounds, for instance. But that being said, I often think back about what they were doing different in those venues than what we do in medicine, and try to at least bring some of that to what I'm doing.
And healthcare is going through such a major change right now. So thinking outside the box is one of the keys to adapt to this change. Throughout your career, you have been very actively involved in resident and medical student education and education for the fellows. What are the traits and habits of the most successful of these that you have come across?
That's a great question. I think that when you're early in your training, you should be almost an open book, because you can essentially learn from anyone, and any experience can be a learning experience, even a bad one, because you might be able to say, I don't want to be like this person, or I don't want to be like that experience, and I don't want to experience that again. I think that that's critical. I think second is perseverance, because you're only going to get as far as you're willing to go. I think that's a sort of tried and true. And the third thing is probably persistence and honesty and a sort of dedication.
So, one thing you wish you knew when you started out as a career in medicine, what would that one thing be that you have learned along your way?
I think probably the one thing that I wish that I knew from the very beginning is how variable a career in medicine can be, and how you can really shape that career from the very beginning, but that you ultimately have to make those decisions to shape it. And what I mean by that is there are multiple different tracks to success in medicine. So we have 3 different tracks just within our fellowship, and that's just within gastroenterology. I think that's the thing that I didn't appreciate, is just the variety of different career paths you could have. And even if you do one of those 3 tracks in our GI fellowship, there's multiple different careers you can have, because you can become a clinician educator, you can get into administration, you can get into quality improvement, you can get in, there's a variety of different careers you can have. And I don't think I fully appreciated that when I was applying to medical school, for sure, but even when I was a medical student or a resident. And I think that I wouldn't have done anything different had I known that, but I think I would have been even more excited about this idea of career fit that I talked about earlier.
The last question. If you had to tell one thing to young doctors like myself, what is the one thing that we could learn from you that would make a difference in the way that we practice medicine and live life?
I think if you can be truly introspective about where you want to go, and what you want to do and set short and long-term goals for yourself. That is probably the biggest advice that I give anyone on a daily basis that I meet with. And it requires honesty with yourself, and it requires you to sit down and write down what your goals are, to say, this is where I want to be a year from now. This is where I want to be 5 years from now. This is where I want to be the day that I retire. I want this to be on my nameplate. And if you do that, I think that ultimately that's what's going to allow you to really be happy with the career path you choose, but also ultimately, I hope, to be successful.
Thank you, Dr. Barnes. I'm taking away some critical insights from this interview that I believe will help me become a better student and a mentor. One of those things is finding the career fit, as you said, finding that one thing that excites us the most, that excites us to wake up every morning or in the middle of the night to do, approaching each opportunity with an open mind and thinking outside the box. And the third thing that I'm taking away is knowing how to shift the bucket around, the bucket of all the things that you want to achieve in life, that you want to do in life, finding the right balance and knowing when to prioritize what, and anticipating at the same time that there will be moments like these in your life when you will have to shift the bucket around, and it won't work if we're not ready to do that. And lastly, what we just discussed, to be really introspective about oneself and finding the match between your goals, your aspirations to the mentors in your life. And there could be a couple of mentors because there are different things that we want to do. So thank you very much to our audience. Thank you for tuning in with us here on the Medicine Mentors. Thank you for joining us as we learn from the Masters of Medicine. Stay tuned.